What is ADHD? ADHD is a neurodevelopmental condition that can affect attention, emotions, routines, organisation, and daily life. ADHD can look different for every person. Some people may feel restless or impulsive. Others may struggle with focus, memory, or task completion. ADHD can affect school, work, relationships, and home life. Children, teenagers, and adults may need different supports. Support should focus on strengths, needs, and practical daily strategies. How is ADHD treated? ADHD is usually treated through a personalised plan that may include medication, therapy, practical strategies, and support from different professionals. There is no one-size-fits-all ADHD treatment. Some people benefit from medication. Others may benefit from therapy, coaching, or daily living support. Many people benefit from a combined approach. Treatment should consider age, goals, and functional impact. A good plan should support real-life routines, confidence, and independence. ADHD treatment options at a glance. ADHD treatment options may include a mix of medical, therapeutic, behavioural, and daily living supports. Medication may support focus, attention, and impulse control. Therapy may support emotions, confidence, and coping skills. Psychology may help with mental health and behaviour patterns. Occupational therapy may support routines and daily living skills. Coaching may help with planning, organisation, and time management. School or workplace adjustments may improve participation. Daily living support may help with routines and independence. ADHD assessment and treatment. A clear ADHD assessment can help identify how ADHD affects daily life and what support may be helpful. Assessment should be completed by qualified professionals. It may explore attention, emotions, learning, and daily functioning. For children, input from parents, carers, and teachers may help. For adults, assessment may include work, study, and life history. Assessment can guide therapy, medication, and support planning. A good assessment focuses on functional impact, not just diagnosis. ADHD medication options. ADHD medication may be considered when symptoms have a significant impact on daily life and should always be discussed with a qualified medical professional. Medication may help with focus and attention. It may support impulse control and task completion. Some people may use stimulant medication. Others may use non-stimulant options. Medication is not suitable for everyone. Medication works best when reviewed and monitored properly. Many people still need therapy, routines, and practical support. Medication versus non-medication ADHD treatment. Medication may help reduce core ADHD symptoms. Non-medication support helps build daily skills and routines. Therapy may support emotional regulation and confidence. Occupational therapy may support independence and daily tasks. Coaching may help with organisation and planning. Behaviour support may help with safer routines and responses. The right option depends on the person's needs and preferences. Medication and non-medication. ADHD treatment can support different needs, and some people may benefit from both. Non-medication. ADHD treatment options. Non-medication. ADHD treatment can help children, teenagers, and adults build practical skills for everyday life. ADHD therapy may support emotions and coping skills. Psychology may help with anxiety, self-esteem, and behaviour patterns. Occupational therapy may support daily routines and independence. ADHD coaching may help with planning and organisation. Behaviour support may help with practical strategies. School and workplace adjustments may support participation. Daily routines, reminders, and structure can make life easier. ADHD therapy and psychology support. ADHD therapy and psychology support can help people understand their patterns, manage emotions, and build practical coping strategies. Therapy may support emotional regulation. It can help with anxiety, stress, and low confidence. Psychology may support routines and behaviour patterns. Counselling can give space to talk through challenges. Therapy may help adults who feel misunderstood or criticised. Children may benefit from emotional literacy and family guidance. Occupational therapy for ADHD. Occupational therapy can help people living with ADHD build routines, independence, and practical daily living skills. Supports organisation and planning, helps with sensory needs and emotional regulation, builds home, school, work, and self-care routines, focuses on function, participation, and independence. ADHD therapy and allied health support. Psychologists and counsellors may support emotions, anxiety, self-esteem, stress, and relationships. Occupational therapists may help with routines, daily living skills, sensory needs, and independence. Behaviour support practitioners and ADHD coaches may support behaviour patterns, planning and follow-through. Families, schools and workplaces may provide practical guidance, structure and helpful adjustments. ADHD skill building, behaviour support and daily strategies. ADHD support can help people build practical skills for everyday life in a calm and respectful way. Build planning and time management skills. Use reminders, timers and checklists. Break tasks into smaller steps. Support emotional regulation and transitions. Understand behaviour, triggers and unmet needs. Create safer and more predictable routines. Encourage confidence, independence and follow-through. ADHD support for children, teenagers and adults. ADHD support should match the person's age, goals, daily life and responsibilities. Children may need help with school routines, emotions and transitions. Teenagers may need support with study, confidence and independence. Adults may need help with work, relationships and daily planning. Families may benefit from education and practical guidance. School and workplace adjustments can support participation. ADHD daily living support and practical management. Practical ADHD strategies can make everyday tasks easier to start, manage and complete. Use visual reminders and short checklists. Set alarms, timers and calendar reminders. Keep important items in the same place. Prepare for the next day ahead of time. Reduce distractions and use focus blocks. Take planned breaks to support attention. Celebrate small progress to build confidence. ADHD treatment without medication. ADHD treatment without medication may include therapy, coaching, behaviour support, daily strategies and environmental adjustments. Some people choose not to use medication. Some people cannot take medication. Others use non-medication support alongside medication. Psychology may support emotions and mental health. Occupational therapy may support daily routines. Coaching may support organisation and planning. Parent training and school support may help children. Workplace strategies may support adults. ADHD and the NDIS. ADHD may be considered by the NDIS depending on the person's individual circumstances, eligibility and evidence of functional impact. ADHD alone does not automatically mean NDIS access. The NDIS looks at disability-related support needs. Evidence should explain how ADHD affects daily life. Functional impact may include difficulty with routines or self-management. Support needs may relate to independence, learning or participation. ADHD capacity building supports may be relevant for some participants. Creating an ADHD treatment plan. An ADHD treatment plan should bring together the person's goals, support needs, daily strategies and therapy recommendations. Include assessment findings. Identify ADHD symptoms and functional impact. Set personal, school, work or NDIS-related goals. Include therapy and allied health recommendations. Add medication details if relevant. Include daily living and emotional regulation strategies. Add school, workplace or family support strategies. Review the plan as needs change. How to choose the right ADHD support provider. Choosing the right ADHD support provider means finding someone who listens, understands and offers practical support. Look for experience with ADHD. Choose a person-centered approach. Clear communication is important. Support should be practical and easy to use. The provider should understand emotional regulation. NDIS knowledge may help where relevant. Family and carer involvement may be useful. Flexible support can help as needs change. How Affective Care can support with ADHD. Affective Care provides emotionally centered NDIS and therapy supports that focus on trust, dignity and practical daily support. We support people living with disability, including people living with ADHD. Our approach looks at the whole person, not just symptoms. Support may include therapy, psychology and occupational therapy. We can help with emotional regulation and daily routines. We support community participation and independence. We work with participants, families and support networks. Our goal is support that feels calm, respectful and practical. ADHD support that works for real life. ADHD support works best when it is practical, respectful and connected to the person's real daily needs. The right support may include medication, therapy, daily strategies, psychology, occupational therapy and support at home, school or work. At Affective Care, we focus on trust, dignity and emotionally centered care that helps daily life feel more manageable.